volunteers, what were you thinking about while you were doing that? Were you thinking about what you were going to have for lunch? No. Were you thinking about what you needed to do when you got home? No. Were you thinking about where you're going on vacation?
No.
No. You were thinking about one thing only.
Their name.
Their name and what you were going to do when you got that ball. Right?
Yeah.
That's what mindfulness is. Okay? Knowing what you're doing as you're doing it. Checking in. Bringing, it's like beginner's mind. You know, that's what we talk about. We talk about it like a baby. A baby gets up and they see a flower. They want to spend half an hour looking at that flower, smelling it, touching it. We lose that as we get older and we move more and more and more into automatic pilot. Well, doing an exercise like that jerks us right out of the automatic pilot, right? We're doing something new. We don't know what's going to happen next. We're curious, we're excited, we're sort of paying attention with every fiber of our being. Yes, Sheila?
That's what I was going to say is, not only was I trying to remember Gordon's name, but I was trying to remember all the other names, and I was kind of like, I froze.
Yeah. Yeah, but you were intense on a single task, right? Yeah. And you weren't multitasking, which gets a lot of press in this world. It's supposedly a good thing to do. Well, what I'm talking about is the absolute opposite of that. It's not multitasking, it's single tasking. Because one thing that we know, multitasking does not mean that you do a bunch of things well. It means you do nothing well. You can't. It's physically, emotionally impossible to do several things well at once, okay? But you can learn how to take care of yourselves much better. None of this is a magic bullet. People say, oh, you know, I want to become less stressed. Well, yeah, we all do, but it took a long time to become stressed, and it takes time, dedication, and a willingness to practice to become less so. I want us just to do a little exercise together. Also, if anybody's interested, there's this guy called Mark Gorkin, and he calls himself a stress doctor. He's not a doctor, he's a social worker. But he talks about a stress barometer. And the stress barometer has to do with what's going on. It's the 3 B's. What's going on in our brain, what's going on in our body, and what's going on in our behavior. And one of the things that I do with the caregivers that I see all the time is that we just stop. Remember S-T-O-P? And we check in to those 3 things. So we say, paying attention to our breath for a minute or two. What is the state of my body right now? And it's not to spend a lot of time on it, it's just to say maybe relaxed or tight or tired. And then I ask them to identify what's the state of my brain right now? Clear, confused, muddled. And then, what is my behavior right now? Agitated, angry, yelling, crying, rigid. It's just a short little stress barometer. You do that a few times a day, you begin to have more. You see, again, it's bringing this quality of interest to what's going on with you. It's not saying, I've got to solve this, because these things often solve themselves. if you recognize what's going on, it's the first step, right? You then have some options. If you know that your shoulders are feeling tight or sore, you have a chance to do some stretching or something. Part of the mindfulness-based stress reduction program is yoga. I'm a longtime yoga practitioner, and it isn't about holding poses for 20 minutes. It's about bringing a sense of awareness to what does that mean when I tense a muscle and then I release it? What does that feel like in my body? So let's end with a little exercise here.